Welcome back from lunch. We're in the home stretch now. Just 3 speakers left. But I'm really excited, and I am honored that you chose to come to our conference, because we never thought that you would come to our conference. So we're honored that you're here, and I know everybody's excited, and everybody's been wondering, when's Dr. Cowden going to speak, and all that kind of stuff. So just to give you like a little, just a flimsy paragraph on this guy, probably just if his career's a mile, this is probably an inch of it. He is a board-certified cardiologist and specialist in internal medicine, internationally known and recognized for his proficient technique in the use of evaluative kinesiology. I did that. Dr. Cowden has refined treatment protocols for cancer, Lyme disease, autism, Parkinson's disease, fibromyalgia, chronic fatigue, as well as many other medical conditions, including reversing heart and vascular disease. So he fits in great with what we're doing here, because he was already working on Lyme disease and autism. So let's give him a round of applause. Welcome.
First, let me say that I am not a Lyme expert. I treated my first Lyme patient it's about 8 years ago, I guess, 7 or 8 years ago. One of my elderly woman patients who had breast cancer, metastatic breast cancer, who got better, came to me one day just very distraught because her grandson was at that time 3.5 years old, and he had autism. And she said, you help me, can't you help him? I said, I've never treated an autistic child. I don't know if I can help him. She said, would you try? I said, yes, I'll try. So she brought him to me and evaluated him with kinesiology, and found that he had a lot of allergies and a lot of nutritional deficiencies, and that he had a lot of toxicity. So I put him on a different diet and gave him some supplemental nutrients, and we started doing some laser detox on him. And just a few days into the laser detox, even though he had up to that point not said any words, not fed himself, played normally, looked in anybody's eyes or anything, he was getting the laser detox. And right at the end of the laser detox session, he looked up at the shelf right beside where he was sitting, and there was a little toy dog sitting there, and he pointed at it and he said, "Doggy." And then he looked straight in his mother's eyes, and we said, "Oh, we're on the right track." And we continued to do detox and reevaluate energetically and make changes as indicated by energetic testing. And between 3.5 years of age and 5 years of age, he became perfectly normal. So he went into a regular school, and at 5 years of age, he was able to outperform all the other children in the same school, same normal school. So when I mentioned that case presentation in a meeting in Las Vegas in, I guess that's 2005, Andrea Lalama, who's part of your group here, heard me speak, and so she came up afterwards and said, "Can I bring my children to see you?" I said, "You want to be the second and the third children that I've treated?" She said, "Yes." I said, "Okay, you can come." So she brought the boys over, and they were just a little less than 2, a little less than 4 at that point, and they were able to speak a little bit, but it was mostly just echolalia, just one word, whatever mom spoke. But by the end of a week of the avoiding the allergens and taking the right supplemental nutrients and doing the laser sweeps, they were speaking long phrases and sentences. So she was very pleased, and she made me a celebrity in the autistic realm because of the people that she had contact with. So that's kind of the background. I'm going to talk about this laser detox because that's what I was asked to talk about. I find it a very useful tool in treating a lot of different conditions. Do you know about, before I go into that, do you know about Codex Alimentarius? Okay, Codex Alimentarius is the laws that regulate the foods and the food supplements. Since the pharmaceutical industry could not get the Congress to pass the Codex Alimentarius, they've gone an end run. They've actually caused this to be incorporated into the World Trade Organization. So any country that signs the WTO agreement automatically becomes subject to the rules and regulations of the Codex Alimentarius. The Codex Alimentarius will probably follow the guidelines that are established by the European Union. If you know anything about that, that's not a good thing. In Germany, for example, the amount of vitamin C that you can get without prescription is now 60 milligrams per capsule or tablet, okay, instead of 1,000 like we have over in this country. And so if you want to get higher amounts than that, you have to get a prescription, take it to a pharmacy, and get it filled for many times the price that you would pay for vitamin C in this country. Pardon? I didn't hear it.
Let's wait for Q&A though, okay?
Yeah.
Keep going.
Yeah. Okay, so anyway, just copy down this site at the very top of the page here. It's also in the syllabus if you have a syllabus, but the no Codex Genocide is a very important topic because if you have an autistic child or you have a friend or family member who has an autistic child, very soon it's likely that you're going to have a hard time getting access to the nutrients that are going to make that child better unless you do something politically to keep it from happening. At this point, probably the only thing that can happen is to enough of the lay public of the United States to put force and pressure on Congress to withdraw us from the World Trade Organization. The United States can still have trade with other countries without being part of the WTO. That's a fallacy, an incorrect assumption that we can't participate in world trade if we're not part of the WTO. Okay, so I want to say, as it relates to the topic of autism, that I've come to, in the brief period of time I've been working with autistic kids, come to believe that there are certain things that are really the crux of the matter with autistic kids. Autism is not caused by a single thing. It's caused by a spectrum of things in every child. And but I find in every child that I've evaluated so far that Mercury is a major issue. And without resolving or dealing with the Mercury sufficiently, the children usually don't get a lot better. And that's one of the reasons why the laser energetic detox helps, because you can get the Mercury out very quickly without damaging the child. The other thing that is a part of the syndrome is the genetic defects that cause inability of the child to detoxify the sulfation pathway and the methylation pathway detoxifications. So in the process of treating children, I always look at that and try to give the right nutrients to address that. The other thing is the infectious causes of inflammation in the brain, and that's Borrelian viruses and a variety of microbes. And then other causes that contribute, but probably less critical than those first three, are food allergies, parasites and fungus in the gut creating leaky gut, man-made toxins, a variety of those, pesticides, herbicides, solvents, plastics, heavy metals, and then electromagnetic fields. And that's a big one because electromagnetic fields disrupt the blood-brain barrier. So it's very important to get rid of the portable phone that's in the house. Don't even have it in the house, because the portable phones have a negative effect on the child's brain up to many feet away from where the child is. And then there's a variety of other things. The nutritional deficiencies, miasms, which may not be enough time to talk about, and then ergots. Those are fungal toxins that are found in wheat and other grains, corn also. Okay, so let's talk a little bit first about the mercury, and this is a graph of the. Can you see that very well in the back? It's kind of light, isn't it? Doesn't project very well. Anyway, this is these are bars right here that represent the cumulative mercury exposure through childhood vaccines in 19 to 35-month-old children that were surveyed. And this line on the top is the rate of rise of autism in California, which perfectly parallels that rise in mercury exposure. And the reason I'm talking about this is there's something we can do about that. First of all, we can avoid the vaccines. We can also limit the amount of mercury exposure by various means, and we can also get the mercury out using the laser detox. So anyway, this is other proof to the hypothesis that mercury is a major cause of autism. In the early 1980s, there was only 1 to 2 children out of 10,000 that had autism. By the late 1990s, it was 1 in 500. By 2000, it was 1 in 250. By 2004, it was 1 in 166. And now in New Jersey, it's 1 out of 99. The United Kingdom, about the same. Denmark, where they have a lot less vaccines, a lot less mercury exposure, a lower incidence of autism. This is the amount of increase of mercury in vaccines over, from the 1970s up through 1992. About a tripling of the amount of mercury in vaccines during that time period, and that's when the autism skyrocketed. All the mercury doesn't come from vaccines. It comes from, most of it comes from actually the mercury fillings in the mother's teeth. And so the child starts getting filled up with mercury from the moment that the conception occurs. This is some research from Dr. Boyd Haley where they looked at the amount, of nerve cells that were alive in a tissue culture 24 hours, during the first 24 hours after exposure to different toxins. So you see in this top line up here, there's no exposure to any toxins, and only 5% of the nerve cells die. 95% are still alive. But in the next one there, that's thimerosal. That's the type of mercury that's in the vaccines. It drops down to here, which is about, only about 30% of the neurons still alive. If you look at the aluminum hydroxide, that's what they use to replace some of the thimerosal in the vaccines. It still kills some cells, but they've left some of the thimerosal in there. They're just not required to put it on the label anymore. So if you look at the combined effect between the thimerosal that's still left in there and the aluminum hydroxide that they've used to replace part of it, then that combination is listed here in this triangle down here, which is very low. Okay, only about 5% survival of the neurons. If you happen to expose the person to antibiotics represented by neomycin, then you end up in a low survival of the neurons here. And if you get exposed to testosterone, which the incidence of autism is much greater in boys than it is in girls, so 100% of the neurons die in less than 4 hours. So that's not a good combination. Thimerosal plus testosterone, or thimerosal plus some of these other toxins, causes rapid deterioration of the nerve cells. And all this information is on that website, the evidence of harm. This is a study that was done by the government where they showed the amount of mercury that came in from methyl mercury versus ethyl mercury. Methyl mercury is found in fish, and ethyl mercury is found in the vaccines. Well, the government reported that the ethyl mercury was safer, but they didn't look at the whole study. The whole study shows that the greater degree of toxicity comes from the ethyl mercury because it's converted to inorganic, which stays in the brain longer and causes more damage. Lots of sources of mercury: burning of coal, eating of fish, playing with mercury, industrial exposure. But again, this is probably the primary exposure here besides vaccines, which is the mercury from the mother's mouth that goes into the child. I had a 6-year-old child with attention deficit disorder, hyperactivity syndrome, and this child showed energetically that mercury was the primary cause. And when I asked the mom, does the child eat fish? No. I looked at the child's mouth, no mercury fillings. I looked in the mom's mouth, no mercury fillings. Well, Mom, do you eat fish? No, I don't eat fish either. The grandma was sitting there in the room, and this is the mother of the patient's mother. And I said, "Do you eat fish?" No, she doesn't eat fish either. Then I looked in her mouth, and her mouth is filled with mercury. So the mercury in the child that I was looking at came from the grandma. 2 generations. And here's the reason. The mercury level in the cord blood is twice as high as it is in the mom. So it's going. Basically the fetus becomes a wastebasket, a sump to take up the toxins that are in the body. And then we have all these other sources of mercury. not enough time to go over all that. This is all in the syllabus too, so you can look at it later. This was a study done back in the early 1990s where they had 1,569 patients that had murky fillings in their teeth with a variety of symptoms, allergy, chest pain, depression, dizziness, fatigue, insomnia, irritability, bowel problems, irregular heartbeat, memory loss, vision problems. And the percentage of patients that improved when they did nothing but just take the mercury out of their teeth is over here on the right side. It's all over 60%. Most of them are up around 90%. So mercury does cause symptoms in children as well. Okay, here's the problem. If you attempt to take the mercury out of the body before you take the mercury out of the teeth with a chelator, usually you pull mercury off the surface of the amalgam and put more mercury into the brain. So it's a bad idea for a mom that's pregnant to do any mercury amalgam removal because she's going to put a lot of mercury into that fetus in the process of just trying to get it out. So the best way is, if you're thinking about getting pregnant, get the mercury out of your teeth, go through a good detoxification process for a year or two, and then get pregnant, so that you don't dump all that mercury into your baby to start with. There's right ways and wrong ways to do that. The correct way to get the mercury out of your teeth is to take about 1,500 milligrams of chlorella daily. You start at a lower dose and build up to that. And then you do that for about 2 weeks and then go over to the dentist and get the dentist to take some of the mercury fillings out. If the dentist does it the wrong way, the patient can get worse. If the dentist does it the right way, the patient can get progressively better. The wrong way is to take a huge burr, a huge drill bit, and just pulverize the whole filling, make it into a liquid and gas that you breathe in or swallow. The correct way is to take a very fine burr, make a little tiny slit across it, put an instrument in there, pop those two pieces out, and put those in the biohazard container where they belong in the first place. The U.S. government makes dentists handle silver mercury amalgam material before it goes in the mouth like a nuclear reactive material, only in a biohazard container. And after it comes out of the mouth, it has to go in the same kind of biohazard container. But the American Dental Association says that while it's in your mouth, it's perfectly safe. Something really wrong with that logic. Okay? Now, the other things that the dentist should be doing is they should put a rubber dam that's like an upside-down umbrella around the tooth to catch all the particulate as they drill on that tooth, so that it doesn't get swallowed or absorbed through the lining of the mouth, and it gets suctioned out with the copious water irrigation and high vacuum suction. And then running a negative ion generator in the operatory where they're drilling on the tooth is also helpful, because that negative ions will actually precipitate the mercury out of the air so it's not breathed in by the patient and the doctor and the staff. Also, it's helpful to breathe some oxygen through nasal prongs while the mercury's being drilled out, because that causes the person to breathe more shallowly, so they're not going to breathe as deeply and breathe so much mercury deep down into their lungs. And then one of the cheapest and easiest things that works great is to do what I call a chlorella swish and spit. So you take some powdered chlorella to the office with you, about the same amount that you would do as a daily dose, and you put that into about an ounce of water. Right after the dentist finishes drilling all the mercury that they're going to drill that day, you put that green slurry into the mouth and swish it around for about 2 or 3 minutes, and then you spit it out. Don't swallow it because it's really toxic. And then put more water in, swish and spit, more water, swish and spit until there's no more green coming out. And that'll usually bind up a lot of the mercury that gets freed up during the drilling process. And then after that, very important to do this, adjust the bite while the patient's skull is in alignment, their neck is in alignment, their back is in alignment, their hips are in alignment, their pelvis is in alignment. If you adjust the bite while any of those other joints are out of alignment, then those joints will stay out of alignment long term. So it's very important to learn how to adjust the joints. In one of my seminars, I think it was in May of this year. No, it wasn't. It was in July of last year. I gave a full course on how to do self-adjustment. So anybody in the audience can learn how to adjust all their own joints. So that when they go to the dentist's office, they do that while they're in the dentist's office, and then get the dentist to adjust their bite. Okay, so how do we end up sick, or how do our children end up sick? It happens because we get a total body burden, a load that causes a progressive illness. And it's a combination of things, emotional, spiritual contributors like these emotions that are listed here, quantum physical. This gets ignored for the most part by a lot of the medical doctors in the country because they don't know anything about the impact of electromagnetic fields on health. But they do in Sweden, they do in Germany, so why don't we learn from them? Geopathic fields, miasms, other things that are ignored for the most part in this country. And then chemical, there's something known about that, but not a lot done about that in this country, the chemical pollutants. And then the biological, the bugs, the critters, and immune dysfunction and so on. So this is what it looks like as an analogy. If this is the human body right here, represented by this bathtub, if a person is sick, the bathtub is completely full of dirty water with dirty water flowing over onto the bathroom floor and making a mess on the floor. Now how did it get dirty? How did the dirty water get in there and how did it start flowing over into the bathroom floor? Because the dirty water faucets here at the top were all wide open. Those dirty water faucets are nutrient-depleted foods, electromagnetic fields, radiation pollution, toxic relationships, toxic emotions, polluted air, heavy metals, antibiotics, pesticides, biotoxins, microbes, and so on. And then on the other side of the bathtub, all these water spigots that are water faucets that are supposed to be open are not. They're closed off. So that's the healthy foods and nutrients, the sunshine, exercise, purpose and will to live, good relationships, peace, joy, love, great attitude, pure water, fresh air, etc. So those should be opened up. These should be closed off. But in most cases, it's the other way around. Down at the bottom of the bathtub are the drains that get the toxins out of the bathtub. Those are the toxic bowel, the toxic liver and gallbladder, the toxic kidneys, and the clogged up lymphatics. We have clogged up lymphatics because we're couch potatoes. We don't ever exercise. The lymphatics are squeezed between the muscles, and that pushes the lymph fluid back toward the central circulation so it can be cycled through the heart and liver and kidneys and out of the body. But if you're a couch potato, it just stagnates. It just sits there. The bowel's toxic because of the food choices we make. We eat a lot of mucoid-producing foods that clog up the plumbing in our bowel. So we get a thick, sticky, rubbery junk that plasters itself up against the bowel wall that prevents the absorption of foods and allows bugs to hide behind it to create biotoxins that poison our body. And I think at the end of this slide set, I've got some pictures of what that looks like, but it's nasty stuff. You don't want that to build up in there. And then the liver and kidneys are toxic because of the bowel being toxic and because of the lymphatics being toxic. Also because of emotions. If you get really angry and you don't release the anger, you know what happens? You build up physical toxins in your liver and gallbladder, and you become sick because you build up physical toxins in your liver and gallbladder. The anger becomes like a magnet to attract those physical toxins in the liver. So first step, back on this analogy, is to close off the dirty water faucets here, open up the good water faucets, and then open up these drains. That's how you get well. And when you do that, first of all, the water starts getting clearer because there's not the dirty water running in, there's only clean water running in, and then the level starts going down because you've opened up the drains, and pretty soon you can see the bottom of the bathtub, and there's no water flowing over on the bathroom floor creating symptoms. So that's what that's about, closing off those dirty water spigots. Don't let any more chemical pollutants in than you have to, and try to have only healthy relationships and balance the terrain, the pH of the tissues, and deal with the toxic focuses in the body, the infections that are in the body. Okay, this is an important slide. So how do you detox? And you can use these principles on yourself. You can use these principles on your children, but just go slowly with the kids, because you can you overdo the detoxing process, and they can get symptomatically worse for a time. But saunas are extremely helpful. If you can't afford a sauna, move to Phoenix, Arizona this summer. We have a sauna there every day. If you can't afford the sauna, though, seriously, you can actually do what we call clay plasters. Anybody can afford some dry calcium bentonite clay or some pteramine clay powder, and you mix that with some pure water, warmed up preferably, not cold, and you put that on the child's skin or on your own skin. And you don't put too much on at a time. The first time you put on an amount about the size of a hand, and then the next time 2 hands, and the next time 3 or 4 or 5 hands. And so you keep building up until you can cover almost the whole body. But the clay will actually draw toxins out of the body, especially if the place that you're doing it is a warm room where there's a little bit of perspiration and sebaceous oils come out of the skin. Those toxins are in those secretions from the skin will actually be bound up by the clay. You leave it on there till it dries, and then wash it off or wipe it off with wet cloth. The ion foot cleanses can be helpful, but also again expensive. Something that's not terribly expensive is the foot pads. The foot pads are basically pearl powder mixed with a wood vinegar, and you put those pads on the soles of the feet, and they're white when you put them on at night, and when you wake up the next morning, they're black or green or brown or nasty, gooey stuff on them. And you just keep doing that till there's no more gooey, nasty stuff coming out. Now, if you can't afford the Takara foot pads even, you can take a raw white potato and tape that to the bottom of the foot, and it'll pull the toxins out. Okay? Anybody can afford a potato, right? Okay.
Organic?
Yeah, preferably organic. Preferably organic. Okay, the detox baths. There's a lot of different types of baths that you can do. Epsom salt baths or ginger baths or different types of herbal baths. Those help to pull the toxins out through the skin. My favorite is actually an ozonated bath, but not everybody has an ozone machine, so that's not feasible for everyone. And then a modified fast. When it says fasting, I usually don't mean like a water fast. I usually mean like a raw vegetable juice fast to help to put the body into a mode of releasing toxins. They release the fat-soluble toxins, especially when you do that. And then taking enzymes between meals. If you take the enzymes between meals, the enzymes are absorbed out of the gut and they get into the bloodstream and they digest the protein coating that's on the surface of bacteria and viruses and funguses and other creatures that you want to remove from the system. The enzymes will also digest that thick, sticky mucoid material that lines the gut and help to flush it out. Taking a lot of fiber to flush the stuff out of the bowel. Psyllium, slippery elm, rice mucil, marshmallow root, Jerusalem artichoke, etc. And then do enemas or colonics or clemics. And you can do a little enema in a child sometimes when they start getting really toxic, and it can help to resolve the toxicity faster. Just let it go in by gravity. Don't force it in. Just slow drip in. Liver gallbladder flushes can be helpful even in kids. So you can do I think the best for a child is actually, unless they're allergic to it or they have too much fungus, is apple cider. Apple cider will soften up the stones inside the gallbladder and bile ducts so that when they do pass, they don't cause any harm. If there's a fungal problem, then the other thing that you can use is orthophosphoric acid in a bit of water. Orthophosphoric acid needs to be washed out of the mouth after you swallow it, though, because if you leave it in the mouth, it will etch the enamel of the teeth, so you don't want that. You want to swallow it and then chase it down with some more water. After you do that, orthophosphoric acid or apple cider vinegar for about 3 days, then you can do a flush. The flush is taking, for an adult, about a quarter cup of olive oil and a quarter cup of lemon juice and then going to bed. Usually you take a little bit of Epsom salt, too, to make sure you have some Epsom salt by mouth so that you have a good bowel function the next day. And you'll see green little balls coming out in the toilet. Doing some exercise. Kids, that is usually not a problem, but adults that need to detox really need the exercise. And then the dry skin brushing is helpful, and that almost anybody can afford a little vegetable bristle brush that you stroke the skin with. About 6-inch long straight strokes, not scrubbing like a pot, but just very light strokes to stimulate the lymphatic system. Chi machine you can buy those now for about $60 off the internet. Kids love those. The Chi machine is like a big toaster that has inside of a motor that has plastic cradles on top of this motor that are attached to the motor, and when the motor runs, the cradles move back and forth like this. So if you lie down on your back on the floor, or the child does, and put the ankles up on that cradle, the ankles start doing this, and then the whole body starts moving like a fish. And so you get rhythmic contraction, relaxation of the muscles. It squeezes the fluid in the lymphatic system back toward the central circulation. The best way for the lymphatics to come out of the body is not through through that route, though. The best way is to clean out the bowel first and let it come out through the cisterna chyli into the gut. But so many people in this country don't want to do anything about their guts, so you have to use the other way. Okay. Genetic testing I find to be helpful. I'm working on a program now to be able to do the genetic testing with an energy evaluation without having to do the expensive genetic tests. And so hopefully in the next few months we'll have that available. But in the meantime, you can do the blood testing or the other tissue testing to find out what the genes show in the way of the detox pathways, and then give the right supplemental nutrients and diet to correct some of that difficulty. And then the herbs to help to detoxify, the homeopathics to help to detoxify. Now, we're going to finally go into the laser detox. So this is like the background of what you add on to the laser detox. If you don't do any of the basics first, you're going to get some results, but you're not going to get as good a results as you would if you do all the things that we talked about first. And then, what is laser detox? It's taking a laser pointer like I've been using here to point up there, but instead I put a little rubber tubing on the end with a hole in it to hold a vial. I don't know if you can see that from back there. And then when I shine the light, it's no longer a point, is it? It's a line. Can you see it on the screen? And so if there were a child up here or a person up here and we were sweeping up and down like this, we'll be carrying the energy that's in this vial into the patient with a light. And that does something quite extraordinary, actually. We learned back in 2001 that it causes the release of toxins from the body. Let me show you this case so you can understand. This was a 45-year-old man that came to me with neuropathy below his knees. That means he could not feel any light touch below his knees, but he had continual pain below his knees. And he gave the history that he had washed carburetor parts in a barrel of gasoline with his bare hands for many months. And so when I checked the gasoline, homeopathic, against the nervous system point, it was very much indicated that the gasoline was the cause. So I made up a vial of homeopathic gasoline and gave it to the technician with a little light like this. And I said, go into that dark room and shine this on the patient this way and come back out when you're finished. Well, she had only been in there a minute or two, and she came running out. She says, I can't stay in there any longer. The whole room smells like gasoline. Then a few minutes, less than a minute later, the patient comes out and says, you need to get an exhaust fan in there. So I went into the room, and sure enough, the whole room smelled like gasoline. But just with that one sweep, the patient's neuropathy progressively improved to the point he was free of pain and normal again. So what the sweeping does, I think, is it carries the energy, the homeopathic energy of that substance into the body in a way that the body can process it and release it. If you just gave the stuff that's in this vial as drops, usually you get really harsh reactions, and it takes a long time, if you don't want harsh reactions, to build up to a dosage that you can get the detoxification process to occur. But if you do it with a light, somehow the body has the innate wisdom to pick what it wants and reject the rest, and it does something magic with that. So we found that with this process you can resolve toxins quickly. Most man-made toxins like pesticides, herbicides, solvents, and so on come out of the body in 24.5 hours instead of weeks to months like it used to take us. And we can resolve allergens for the most part very quickly, 24 to 48 hours. The autoimmunity, every child that I see with autism has autoimmunity of their brain. And what I mean by that is that when you take a vial of healthy nerve, tissue, and brain and put it on the child, they weaken. And if you put a vial of the toxin that's causing that onto the body, they weaken. But if you put both of them on the body at the same time, they become strong. If you check the nervous system point with that vial of nervous tissue, it shows that they need it, but they can't tolerate it. Okay, so they have what I call an energetic autoimmunity. You can resolve those usually in just a few hours, or at the most a few days if the patient has a lot of different toxins. So it's taken us 6 years to develop the process to do this without creating significant adverse effects in the patients and the children. You can also even knock down the levels of infections very quickly, especially viruses and the viral residual of vaccines. So this is another case, an elderly woman that had no money to speak of. She said, "Can you help me?" So we did the evaluation energetically and found that mercury was a significant contributor to the Parkinson's disease that she has. So we did the little vial and swept her body with mercury, and she had a 50% reduction in the Parkinson's tremor in just one treatment. And she was so excited, so pleased, she came back for another visit, borrowed some money from a friend and came back for another visit. And this time we evaluated and found that she had DDT, which has been banned for 40 years in the United States, but it's still in most of us sitting in this audience, okay, because the half-life of DDT in the soil is 50 years, the half-life in the human body is longer than that, okay? And so we swept her for DDT, and she had additional improvement in the tremor. And for the several months that I was able to follow her after that, until I lost her to follow-up, she continued to have improvement. So 2 sweeps, she's 90% better. A lady with insomnia, 10 years of insomnia, drug-resistant, found that she had two pesticides that appeared to be contributing to that energetically. So we did the sweeps for the pesticides and for the 2 neurotransmitters that were showing that they were autoimmune, that they were negative. And that night she slept 10 hours. So these were cases before the first autistic boy that I treated. I'll show you his case in a few minutes. So we were trying to figure out, how does this work? This is this vial that we put in front of the light. It's always a homeopathic. It's always what we call a multi-cord. It's multiple dilutions, really low dilutions, really high dilutions. Really low and really high dilutions of the same thing, same substance, and all in one vial. And somehow, as I said, the body has the innate wisdom to know which one of those to pick, which one of those dilutions to pick, and it rejects all the rest. And so we know that it works. So I went back to the literature to try to find out why it should work or how it works. And this is one of the studies that I came up with. This is what we call a meta-analysis. So they analyzed 105 different clinical control studies on homeopathy. And they addressed a lot of different conditions: cardiovascular disease, respiratory disease, infectious illnesses, hay fever, rheumatic disease, trauma, psychological illness, and so on. And on those varied types of illnesses, 77% overall of those studies were positive results, or positive outcome from homeopathy. Now, what you would expect randomly would be about a 20 or 25% improvement at best, but they had 77%, which is more than 3 times that. So we know that the homeopathy does work, even though conventional medicine in this country doesn't understand how it works. Even though they still laugh at it and say that it's worthless, it does work. This is the first controlled trial on homeopathy that was done. The father of homeopathy in Germany was called Hahnemann. Dr. Hahnemann became very famous, and he was called by Napoleon to come to the front lines where Napoleon was fighting the war, not because the soldiers were dying from bullets, but they were dying from cholera. They were getting dehydrated from the diarrhea of cholera. So Hahnemann went to the front lines, and all he took with him was some clear glass vials of water and alcohol, nothing else. And when he got to the front lines, he collected the diarrhea secretions from the soldiers, put it into the vials, succussed it, diluted it, succussed it, diluted it, succussed it, and diluted it till he got the dilution that he thought would be effective. Then he administered that homeopathic dilution to the soldiers. The mortality rate dropped from 80% to 20%. That's not a placebo effect. Okay, that's a real effect. So, then the electrodermal screening is what I actually use now because it's faster. Time is money, and I don't want the patients to pay any more than they absolutely have to find out the information they need. So I've helped design some software to run a electrodermal screening device, a computerized device that can automatically determine what the toxins are, what the importance is, what the relationships are to organs and glands and hormones and neurotransmitters, and also to the emotions and the flowers and colors associated with those emotions. So the background for that, though, is Dr. Voll in Germany, and his type of science has been well studied in Germany, but pretty much ignored in this country. And then the work of Dr. Popp. He's the German doctor who's done the most research on the effect of light on the body. So we don't know exactly how it works, but we know that it does work. Healthy cells make light. Healthy cells make biophotons, they call it. And sick cells don't make biophotons, or don't make very many. So one of the things we know is that a sick cell can be nursed back to health if it gets enough biophotons from its neighbor. Well, when you do the light, you're actually delivering some biophotons into the body, and so this may be a necessary supplement of photons to help those sick cells to regain health. The other thing is that we're not only delivering light, we're delivering information or energy. So the information that's carried by the light is probably acting upon cells, or on either on the cells of the ground matrix, the cells and the ground matrix around those cells, or on the autonomic nerves that give some signals to the body to tell the body what it's supposed to do with that information. So here's that little boy I was talking about earlier. Couldn't speak any words, couldn't feed himself or play. He was 3.5 years old at that point, not toilet trained. And so all we did is have him avoid the food allergens, take the supplemental nutrients, and then started doing the laser detox. And after just the second detox, he said, "Doggy," and looked in his mother's eyes. And he would continue to do the detox. One of the things that we also did on him was we gave him cemento. Cemento is a herbal extract of the uña de gato, the Peruvian cat's claw. And by the way, this is not cruelty to the animals. That's a vine. That's a vine that has a hook, a claw in it, a hook like that, that looks like the claw of a cat, but it's not from a cat. Okay. So this vine has been well studied and is known to have antimicrobial properties and anti-inflammatory properties, and so this is the herbal product that tested best for him. So we used that also to help to eliminate some of the creatures in his body. Again, as I said, autism is an inflammatory condition in the brain, and if you have an inflammation, you have microbes causing that inflammation. You have either virus or fungus or bacteria or parasites or a combination of the above. And the cemento, because of its nature, deals with a lot of those different creatures. And we found other products since then that work even better than that. But anyway, by 5 years of age, a year and a half into treatment, he was basically outperforming normal kids. Now I think when Andrea's children came, they were a little less than 2 and 4. I put 2 and 4 to round it off here, but they were able to speak a word or two, but it was just echolalia, and we did the same thing, avoided the food allergens, put them on a few supplemental nutrients. Actually took them off of a couple supplemental nutrients because some of those were actually testing badly energetically. And then we did the laser sweeps for 7 days, and we did sulfa the first day. Now this is something that I just learned about 3 years ago, that a lot of people in this country have the inability to process sulfa antibiotics. But it's in the beef that we eat because the feedlot feeders intentionally add sulfa antibiotics to the feed so that it will enhance the weight gain of the animals and they can increase their profits. So even if a child has never been prescribed a sulfa antibiotic, they can still have sulfa antibiotic in their body if they've ever eaten beef. And this sulfa antibiotic, when it accumulates in the body, prevents the body from taking up and benefiting from sulfur nutrients that are critical for the detoxification of heavy metals and other toxins. So they can't take up and benefit from cysteine, methionine, N-acetylcysteine, taurine, glutathione, or the chelators like DMSA and DMPS. No matter what route you put the DMPS and DMSA in to these kids that have the sulfa antibiotic problem, they don't tolerate it. You can't give them an intravenous glutathione. They don't tolerate it. So anyway, when you get the sulfa out, which only takes 24.5 hours with the light, then they start tolerating and benefiting from the sulfur nutrients. And that was a major piece for both these boys, I think. And then getting the mercury out. And the mercury doesn't all come out in 24.5 hours, but a lot of it does, and it keeps coming out after that unless you do something that disrupts that detoxification process. So we give chelators after that, laser sweep for mercury for several months to keep the mercury moving out. We don't let the process slow up or stop. So by the end of a week, they're speaking phrases and even a few sentences. And they've had additional improvement with a lot of the things that Andrea's learned on her own. And a few things that I've given her some pointers on. I think I've seen the boys twice, haven't I? I've just seen the boys twice, right? Yeah, I saw them initially and then one more time since then. So they're how much better?
My son is in regular kindergarten. He's
Yeah.
pretty much normal except for he's hyperactive, but
A little hyperactive, yeah. So basically normal after 2 visits, not too bad. Yeah. 5 minutes? Okay, yeah, we're almost finished. Okay, I'm going to skip through some of these. Anyway, this shows you the power of light therapy. This lady was woke up one morning paralyzed from the neck down, no history of injury. When her family brought her to me to be evaluated, I found that she had a viral infection, acute viral infection in her cervical spine right here that had caused the paralysis. But behind that was mercury, dioxin, Dursban, Salk polio vaccine. So I just used the light, actually not this one, a different type of light, to treat that spot right there with each of these substances, homeopathic substances. And in about 10 minutes time, she was able to grip my hand strongly and walk out. So there's very much power in the therapy of light. Lady with Hodgkin's lymphoma that had a very short time to live, but we treated her with a light and she lived many more years. Hip pain, bone on bone. So I'm just showing you that, this doesn't apply so much to autism, but there's a lot of different applications of this type of approach. So I teach courses on how to use this, in all types of conditions. So if you have a doctor that's open-minded, get the doctor to come to one of our courses. At the end of the slides here, I'll have a phone number and I think an email address or an internet address. You're reversing asthma, reversing hypertension and diabetes. So you don't need a lot of tools. You need the homeopathic vials. You need the laser. You need some detox support remedies, and those are all taken orally, nothing intravenously. And then the things to help the lymphatic system. Learn how to do the key therapy. Key therapy is a light touch, hands-on technique that I teach all my family members how to use, so that if anybody has trouble, they can immediately stop the problem that's going on. Andrea was having a headache during lunchtime, so I showed her how to do the key therapy for headache, and it stopped the headache in about 3 minutes. Okay, so there's a lot of steps. I write a prescription for the technicians that do the treatments for me, and this is what it looks like. And these are the sequence. If the sulfa drug is present, it has to be done first. Usually then after that, mercury, and then a pesticide, maybe more mercury, the other mercury groups and the gold groups. So there's a specific sequence, but the computerized program that I've co-developed will help to determine what that should be. So a doctor can learn how to do all that in one day. Not too bad. Stop seizures with your hands. These are key therapy techniques. I think this is in your syllabus, but write down that internet address. This will teach you how to use your hands to stop crises in yourself and your family members. Stop heart attacks, stop asthma, stop anaphylactic shock, stop burn pain, stop toxic reactions, stop bleeding. Okay, so there's the next information on the next seminars, and also the contact information. If you have a doctor that wants to learn how to do this, call that number and learn about the next seminar. All right.
I'm taking notes too.
Yeah, I don't think there's probably time for questions, but
We have a Q&A session
at the end, okay.
3:30.
Okay, perfect. All right, thank you.